Top 10 Most Uncomfortable Addictions. Many medication clients and those battling with a particular movement fixation get themselves awkward and unfit to deal with the enslavement. Fixation does and probably will demolish a fiend's life on the off chance that they use opiates or proceed with their ideal action for an all-encompassing period. Consistently, a large number of medication clients and movement addicts in America become affected by their dependence on the point that a huge number of passings happen every year. Yet, a few addictions have more grounded withdrawal indications than others, making distress the client while taking the medication or doing the action, frustrating any endeavors to stop. Here is a rundown of the main 10 most awkward addictions. Number 10. Process addictions. Interaction addictions incorporate sex, betting, gaming, and food, which inquisitively don't generally make the hard medications list however are awkward. Additionally called conduct addictions, these addictions convey every one of the sociological and mental outcomes of compulsion yet need serious actual indications related to substance misuse. While betting, having intercourse, shopping, or eating certain food varieties, dopamine levels in the body become adjusted, like what happens when utilizing opiates. Notwithstanding, mental reliance can add to their psychological or even actual uneasiness. Interaction addictions are pervasive in the public arena, going generally unseen and with most victims unfit to stop. Number 9. Marijuana or cannabis. While numerous states and nations keep on legitimizing cannabis for sporting and clinical uses, utilization has ascended because of its accessibility and expanded intensity. Weed or ganja is the most utilized substance, and numerous individuals battle with the awkward dependence on its dynamic mixtures. Preceded with use, and subsequently, higher measures of endocannabinoids makes cerebrum reliance on weed. Normally delivered synapses are meddled with, and diminished affectability implies that more than 4 million Americans are determined to have cannabis use issues, as per the CBHSQ or Center for Behavioral Health Statistics and Quality. Number 8. Benzodiazepines. Benzodiazepines are a class promptly accessible of professionally prescribed medications used to treat tension, seizures, cognitive decline, and rest problems and are exceptionally addictive. 15 sorts of benzodiazepine remedies help numerous individuals manage pressure, alarm assaults, or clinical wretchedness. When taking benzodiazepines, huge floods of dopamine penetrate the mind, adjusting receptor capacities actuating pleasurable impacts. At the point when an individual takes benzodiazepines to self-cure, addictions can happen. Preceded with misuse causes the dopamine-getting control cells over the cerebrum to deteriorate. In the shortfall of benzodiazepines, the body needs enormous amounts of dopamine. This drop in dopamine causes serious sorrow, fractiousness, and disarray. Different inconveniences incorporate sickness, firmness, difficult muscles, perspiring, rest and focus issues, heart palpitations, and fits of anxiety. Serious conditions of withdrawal will incorporate depersonalization, furthest point deadness, mind flights, tangible affectability, and hazardous seizures. Number 7. Nicotine. Nicotine is among the most well-known addictions. Tobacco smoking is the essential wellspring of accessible nicotine and is an awkward one to stop. Cigarettes and other tobacco items are essentially lawful, and in that capacity, their habit is predominant among a huge number of Americans and numerous others all throughout the planet. Marked nicotine dependence indications incorporate yearnings. Brokenness brings about crabby and restless conduct. At the point when breathed in or ingested as chewable tobacco, nicotine hoists the pulse and goes to the cerebrum, causing an apparent condition of impermanent unwinding. The practically prompt withdrawal manifestations are awkward for clients, yet nicotine can turn into a passionate race that addicts go after when restless. Smoking and other nicotine conveyance structures are tarnished propensities that before long lead to emphysema or cellular breakdown in the lungs, bringing about a difficult end. Number 6. Cocaine. In addition to the fact that cocaine is one of the most noticeably awful addictions in the U.S., but on the other hand it's altogether distorted. Over 1.5 million clients experience the ill effects of a dependence on cocaine, albeit the number has declined from its prominence in the 1980s. A social medication, cocaine in its unique structure, can help energy and make a positive state of mind, but with brief impacts. Clients become dependent on consistent use, particularly while working or celebrating, and the propensity can be trying to kick. Cocaine acts to adjust dopamine and serotonin constructs, closing down the cerebrum's ordinary cycles. The sensations of conduct, support, delight, or want are immediately supplanted by suspicion, state of mind swings, and other enthusiastic or actual costs. Indications of withdrawal incorporate fretfulness, extreme longings, fractiousness, bad dreams, unsettling, and general distress, while intense manifestations can likewise make patients hurt themselves. Number 5. Methadone. Methadone is a medication used to limit narcotic withdrawal manifestations, however clients can frequently get dependent without legitimate clinical management. Methadone helps narcotic and heroin addicts move beyond the most difficult periods of recuperation. Risky resistances happen when methadone is taken for quite a long time. Dependence on this medication prompts victimizers to take high portions, coming about in more than 40% deadly narcotic help with discomfort gluts in numerous states. Withdrawal side effects for methadone kick in following a couple of hours, leaving clients with extraordinary manifestations of fretfulness, nervousness, and influenza-like responses. Side effects can last from 3 hours to over half a month of awkward distress. Like benzodiazepines, the cerebrum attempts to recover homeostasis with liquor, bringing about DT visualizations, outrageous disarray, ridiculousness, and quakes or seizures. Casualties will occur with uneasiness, sleep deprivation, unpredictable heartbeat, hypertension, melancholy, and cerebral pains that may keep going long after the last portion. Number 4. Crack cocaine. Gotten from the first type of powdered cocaine, break is an amazing energizer with a serious elation supplanted by an urgent desiring. Simple to make, rock arose in the U.S. during the 1980s, a reasonable yet profoundly addictive option in contrast to heroin. A mental reliance for this substance makes it difficult to stop manhandling, combined with the higher resilience, which develops rapidly. The medication has at any rate 3 recuperation stages, yet numerous clients backslide because of yearnings returning a long time subsequent to accepting they've kicked the propensity. Number 3. Methamphetamine. Precious stone meth, known as methamphetamine, is a profoundly addictive manufactured medication made with pseudoephedrine, a typical substance used to make cold drugs. This human-created energizer can be grunted, infused, or smoked, giving clients an intense high followed by a practically quick and similarly powerful need. Meth is difficult to stop, and most addicts hazard critical neurological harm, also extreme weariness and misery an accident brings. Clients that build up a reliance on this medication can't deal with their life or even have a snapshot of euphoria without it. Long-haul methamphetamine use prompts cerebrum harm, gone before by enthusiastic guideline and memory issues. The utilization of this medication is joined by forceful, brutal, and frequently insane inclinations, while clinical detox utilizes uneasiness, hostile to psychosis, and antidepressants to redirect mind chemistry. Number 2. Heroin. Heroin is obtained from morphine and is an unlawful sedative delivered by a poppy bloom animal categories, and clients experience extraordinary elation and incredible longings. Addicts of heroin will smoke, infuse or breathe in its fumes while the medication rapidly hits the mind, causing social modifications. Being an illegal opiate, heroin vendors normally cut or blend it in with poisonous added substances to build its intensity. These added substances, some of which are narcotics themselves, cause many excesses, as the road purchaser can't tell the immaculateness of the heroin shy of doing a synthetic examination. Heroin addictions and the resultant shocking withdrawal manifestations cause doctors to endorse different barbiturates to ease distress. Like buprenorphine and methadone, these healing medications are exceptionally addictive and can bring about new addictions without a specialist's direction. Number 1. Prescription opioids. The most addictive and manhandled medications, solution narcotics, incorporate oxycodone, Vicodin, and codeine. Addicts that misuse narcotics get sensations of elation and joy as the medication joins cerebrum receptors to impede dormant transmission signals. It's the seriousness of withdrawal side effects that keeps numerous victims dependent on solution narcotics. Manifestations are awkward, and this present period's length will rely upon how long a client has been as someone who is addicted. Withdrawal indications of narcotic maltreatment incorporate solid, excruciating muscles, nervousness, a runny nose, hyperventilation, rest-or-sleeping disorder, and hypertension that can now and again turn lethal. The intense manifestation will include the runs, regurgitating, stomach throb, queasiness, and sadness. In the next video we are going to take a look at some of the courses of addiction, so stay tuned for this.